So today we're talking about one of the most commonly used phrases in communication skills, which is empathy. A very big word. Many people claim that they're empathetic, but they don't always show it. Let's dive in. Welcome back to another episode of Clinical Communication. My name is Ben. I'm a specialist physio and clinical communication skills facilitator in the UK. And today we're talking about empathy. So let's start off with what empathy is and what it means. It is not sympathy. They are two different things. Sympathy is where you're feeling sorry for someone. You might use the classic words of, I'm sorry to hear that. Oh, that's a shame. Okay. But that is not empathy. Empathy is where you are trying to demonstrate to that person in front of you that you are trying to understand the experience that they have had or what they've been through. Just saying, I'm sorry to hear that, or oh, that's a shame, is not empathetic. It's sympathetic. You're not showing with those words or phrases that you are trying to understand. You're just feeling sorry. We need different phrases or ways to demonstrate how we can show that we're trying to be empathetic with the patient in front of us. So empathy is something we have to demonstrate. It's not just something we can assume the patient thinks we are, because they may have had experiences in the past where they've seen other clinicians and they've just not felt cared for, not felt that they're welcome or the person's interested in them. So we have to demonstrate it. And we'll go through how we do that shortly. But this is an important skill to have, because if patients feel we are empathetic towards them, it can often build rapport and trust, allow us to have a greater influence on their behavior and their beliefs if we're looking to change those things. And also, it can lead to greater outcomes. We know that when clinicians are empathetic towards their patients, if they're delivering the same treatment in the same environment with the same assessment, they get better outcomes compared to those that aren't demonstrating empathy. So it is an important skill to have, because it may be the difference between what gets your patient better or what keeps them the same as they are. So how can we demonstrate to patients that we're trying to be empathetic, trying to understand their situation and what they've been through? Well, the first thing, as I've discussed already in the past, is to listen to them and don't interrupt them. Let them tell their story. Okay? Let them get it out. And then when they've told you their story, let them say everything they want to say and then summarize it back to them. Show that you've heard, show that you've taken it in. But doing those things alone is not enough to demonstrate empathy. You may have listened to them, but you may not have shown you've taken it in or are interested. You may have summarized and repeated it back to show that you've taken it in, but you're not demonstrating it that you've understood their experience. So for the third part, we need a label. And a label is something that will describe, in essence, in a sentence or so, what their experience they've been through. So what makes an effective label? Well, it's going to start with the words it or that. You're not going to use the word I, because this is not your experience. Okay, this is the patient's experience. And also, if you're using it or that, it's easier for them to counteract if you got it wrong. Because there's a chance you may get your label wrong here. So saying it or that is easier for someone to come back and say, oh, actually, that's wrong, compared to you starting with I, because you're not taking as much ownership of it. After you've used the word it or that, you're going to use the words either seems, looks, sounds, or must have. So that sounds really difficult. It looks like you don't know where to go. That must have been really tough. Notice also here I'm using an appropriate tone of voice. I'm not using it happy-go-lucky or really angry either. I'm using it appropriate with those words. Usually empathetic is quite calm, but emotional tone, like I'm using now. So you're going to use it or that, and then the word seems, which can be used for any situation, sounds, something you hear, looks, something you see, and must have, again, can be used in either situation. And then after that, you're going to use the descriptor. So the descriptor is what you feel summarizes that situation best. You may say, it looks like you don't know where to go. That sounds like it was a really difficult experience. It must have been really tough. Whatever it is, okay? Whatever you feel describes that situation well. And then when you say it, pause. And let them respond. There's a small chance you may have got it wrong, but if you've listened well, summarized correctly, hopefully they'll say something like, yeah, or that's right, or yeah, that, you know what, you're spot on. And so make sure, like I said earlier, that you're using a suitable tone of voice to go with it. If you're having a bit more upbeat, happy conversation, yeah, say it with a bit more positivity. If you're having a more firm, difficult conversation, then yes, you can do it in a more firm tone. But on average, as I said earlier, you can use a calm, relaxing tone of voice that's suitable for the situation. And in addition, make sure you time it correctly. Make sure you let them tell that story, summarize it first. Don't just immediately come out with this statement. Because in a way, if you're coming out straight off the bat with it and you're using an inappropriate tone of voice, it's just going to come across fake, like you're forcing it through. Okay, so make sure you give them time to tell that story, get all the information in first, so you're giving the impression you've taken it all in, and then you can make an appropriate judgment for the label you're then going to give. And to be clear with that, you don't need to repeatedly use these labels all the time. 2 or 3 times in an assessment is fine, okay? But you don't need to do it after every statement, because again, it gets repetitive, and again, is more likely to come across as fake. So do it when there's been a lot of information given, or when time's particularly emotional, but you don't need to do it after every sentence that they say. Now, there's one thing to be careful of when you're trying to demonstrate empathy, and that is to avoid the phrase, I understand. Because in reality, do you understand? You may have learned this information in a textbook. There's a high chance you haven't actually been through what the patient's been through. And it can be quite frustrating for patients to hear that at times. And in times, some patients can respond quite angrily to that. So instead of saying, I understand, focus on, yes, listening, summarizing, using your label to describe their experience. Use appropriate tones during the consultation to make sure it's matching their emotions as well. And say it when it feels appropriate. You don't need to use these labels repeatedly during an appointment. If you found this useful, please do share it with other people. Please do contact me and let me know what topics to cover, what guests to get, what ways this could improve. Thank you for watching, and I'll see you next time.